This past year, we have experienced collectively on a global scale, in some respects, the death of life as we had known it for a very long time. That what we have known and cherished and loved and cared for, the routines, the kinds of ways we lived, it has all changed. In the midst of it all, there have been things that have been discovered and things that we have learned that we've been forced to learn. And I think one of the things that has become very predominant is the challenges of mental health and isolation, particularly amongst our seniors population. That many people live on their own or live in long-term care homes or retirement homes, that the challenges that they experience collectively have been challenges that maybe we really weren't paying much attention to and possibly should have. And I think that as the way of life that we have known has died in some respects, out of this, new growth, new birth, new awareness has emerged. And I'm delighted to have Tom Carrothers with us this morning. Tom is the Executive Director of the Canadian Association of Retired Persons for Halton Region. And Tom is going to speak to us this morning about this issue of mental health amongst our seniors population. So it is my privilege to introduce to you Tom Carrothers. Tom, thank you for being here.
Thank you very much. It's a pleasure and a privilege to be with you today to discuss the topics of mental health and seniors isolation. Thank you for including me in your service. I think Leela's discussion last week did an excellent job of talking about isolation and mental health and gave many great ideas on addressing the concerns that come with isolation due to the pandemic. Today, we will discuss similar concerns, but not ones primarily caused by the pandemic. I am definitely not a professional in these areas. All of us within the Halton chapter of CARP are volunteers, but the Halton chapter of CARP has been advocating around the issues of social isolation and mental health for many years. We are passionate about bringing change to the perception of these issues as they relate to seniors and Halton in particular. I look forward to being part of the discussion after. Just like physical health, everyone has mental health. And as with physical health, people's mental health may be at different positions in what we would call healthy. A very simple definition of healthy mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. For those of us enjoying good mental health, we continue after COVID to help ensure we stay healthy. Here is a summary of some of the things we can routinely do to help maintain a healthy state. One is to stay informed, be aware of what is happening in our community, and be an active part of it. We should structure our daily routine, which doesn't mean doing the same thing over and over, but it merely means that when we're getting up in the morning, we have goals, we have ambitions, we have things we want to accomplish. We need to take care of ourselves, to try to eat healthy, well-balanced meals, practice meditation, get plenty of sleep. All the things that our parents told us to do decades and decades and decades ago. We need to exercise regularly. Exercise helps the body cope with stress. A good idea is to keep a daily journal. Write out our thoughts and feelings. It's an excellent way to process our thoughts and to understand what is driving us. The other is to stay positive. Look for opportunities that can help us laugh and have a bit of fun. The first, or one of the first steps to bad mental health is not being able to stay positive in the face of crises. We should focus, as I said, our energy on positive thinking and practice being grateful for what we have. We need to make daily social connections, which means reaching out to our friends, our family, our neighbors, and having a bond and relationship with them. This maintains our mental health, and it also helps them. And if we feel that we are having challenges, we need to seek support when we need it. Regularly, we need to reach out to loved ones or call a mental health professional in the community if we need support. These are all things we can do to maintain our own well-being. Unfortunately, for those who are able to recognize issues and see physicians, they often face discrimination through ageism, and ageism is also one of CARP's major issues. Too often, they are simply told that they are getting older, and things like that are just the result of aging. That may not necessarily be true at all, but it's a first diagnosis too often. So it happens with both physical and mental health issues, and we must be ready to advocate for ourselves. If we don't stand up for ourselves, then we will lose. But today we also want to address the issues that face many individuals in Halton and Oakville who are not able to do that. These are seniors who face mental challenges and isolation. There is a growing body of evidence that this is a significant problem in Halton and is only exacerbated due to the pandemic. I think the pandemic has it's hard to imagine good things from it, but I think it is helping us become aware of the shortcomings that have been going on for decades and decades, be it in long-term care or caring for our seniors who are in the community. For those living in what we might call a stable environment, Halton is a good place to be with resources available to help individuals. But for those who do not, it can be very hard to live, even though help is available. Social isolation and mental health quickly become intertwined and become a downward spiral. Many of those in this situation may be in the lower economic spectrum, and at the same time have a hard time coping with the normal stressors of life. This may mean that they have a hard time knowing how to find help to make their rent payments, how to access food banks, how to get their medications, how to access transit services, and many other activities of what we would call normal life. And yet the resources are available within Halton. Halton has a lot of great resources and people to help those in need. All of this can lead to social isolation, and it simply becomes a spiral of withdrawal. Social isolation and or loneliness can also be a catalyst in mental health issues. You can be lonely and be in the middle of crowds. This is common in university students and seniors. You do not need to be physically isolated to suffer the effects of isolation. Isolation within seniors has many catalysts. The loneliness and the social isolation seniors experience is often caused by having few social relationships or lack of these relationships entirely, which is why it is key that we as a community keep in touch with everybody who is within our community. They could cause these issues having chronic health problems and changing family structures. Social contacts tend to decrease as we age due to retirement, death of friends and family, and lack of mobility. And our family, which has always been part of our life support system, is moving. It's a very mobile society. And so we start to realize that our family support systems are now in Vancouver and England and wherever. Other causes of elder social isolation include disability. As we age, we tend to have more disabilities. As you get more disabilities, you become less mobile. As you become less mobile, you become more isolated. As you become more isolated, you become more withdrawn, and it impacts your mental health. Living alone. Again, the same scenario, the same spiral. If you have limited finances, and it becomes more and more difficult to do the things that you should be doing to reach out to people and to be part of community. And so, again, you become isolated and it affects your mental health. You have no family close by. We touched on that. All of a sudden, families are spread across the entire globe. Maybe you've never been married, so you're truly living on your own. And as you get older and your friends become more distant, that becomes an isolation issue and impacts your mental health. Maybe you have transportation issues. You don't understand the transportation system. You don't have a good transportation system. Try Georgetown and Halton Hills. They have no buses. Maybe you've been divorced, separated, or widowed, and left on your own after a life being lived with someone. And then as you age, you have the inability to remain physically and mentally active. And these become part of that. You have a lack of access and inequality due to rural living or being part of a marginalized group. This is very true of people living in small communities where their friendship links gradually break down as they age. As we said, you got poor health, well-being, including untreated hearing loss. People with a hearing loss become very isolated because they can no longer be an active player in society at times, or you just become frail as you age. You have social barriers, such as ageism that we talked about earlier, and the lack of opportunities for older adults to engage and contribute. There are lots and lots of opportunities too. We know that. Look at us here. We're all taking part in things. But for many, they don't have those connections. They don't understand the possibilities that exist. And just a side note, that caregivers can become isolated. And quite often the caregivers to seniors are seniors, or they can become or they could be their family. And they become so engrossed in being a caregiver that they become isolated from the rest of the community. The only way to be one of the only ways of being a successful caregiver is caring for yourself first. So how can we be of help to those who suffer from isolation and mental health issues, us being the community? As a result of the pandemic, this is the good that has come from it, again, if it can be good. I think we all have an appreciation of what isolation can do to us and our mental health. Hopefully, when we are back to normal, whatever normal is, we will not forget the experience and what effects it can have on individuals. Suddenly, we're aware of what isolation means to people living in long-term care. Yet in many ways, that's been an issue our chapter and other groups that we're involved in have been fighting for over a decade. These things have always been there. So if there is such a thing, the good thing is we're now more aware of it. We need to keep in touch with those in our congregation and the circle of our friends who are no longer able to be as active as they once were. We need to remember the signs of potential isolation and mental health issues and reach out to those individuals. On a broader basis, we need to be aware of the societal causes, such as inadequate housing, inadequate medical services, inadequate food, inadequate financial resources, etc. all can lead to isolation and mental health issues. It is our responsibility to advocate at all levels of government to improve the conditions that can lead to isolation and mental health issues. There is sufficient evidence published that shows that $1 invested in these proactive steps pays back in many dollars. So for those that want to keep a tally, they're good investments, and the investment is returned to the community, not just in the lives of the individuals, but in the cost that comes when these issues are not faced. The region of Halton, as well as nonprofit groups, are attempting to understand and address these issues in Halton. There's a number of activities going on that are trying to develop plans to better address senior isolation and mental health. We need to support these initiatives and become aware of the available resources. I want to thank you for letting me be here today. If you would like, I can put together a list of resources on these topics and send them out to Mike for distribution. But thank you very much.